Nagaland gets its first biosafety lab to conduct researches and tests for viral diseases including COVID-19. Inaugurating the much-needed facility at Kohima today, Nagaland Chief Minister appeals to the people of the state for continued support, cooperation and participation to protect the people and continue to be in green zone free of COVID-19. Death toll due to COVID-19 rise to 3,435 and the number of cases to 1,12,359 in the country. Number of active COVID-19 cases stand at 63,624 with 45,299 recoveries. And severe cyclonic storm Amphan has caused extensive damage in Odisha and West Bengal. Rescue and relief operations and repair works have been undertaken on a war footing basis. Hello and welcome to News and Trends, and you're watching the Daily News Bulletin. The much awaited Biosafety Lab BSL-3 lab was inaugurated at Naga Hospital Authority NHAK Kohima today. The lab was inaugurated by Chief Minister Nipirio along with a host of his cabinet colleagues and officials from the various state departments. In his speech prior to the inauguration, the Chief Minister remarked that Nagaland has been successful in dealing with COVID-19 due to the joint efforts of all the stakeholders, which he termed as Team Nagaland. Rio appealed to the people for continued support and cooperation and participation to protect our people and continue to be in the green zone free of COVID-19.
Today, as we had successfully inaugurated the laboratory to test the samples, state government could spare some fund to procure these PSL labs, and we hope this will be used carefully to protect our people. If anybody who is coming back is even test positive, you never know, because they may be safe in their own places, but in their journey, you have seen in the social medias, they'll be passing many areas and the social distancings are not maintained, and the people who deliveries and the workers, it is very dangerous, very contagious. So if anything happen also, there should be no stigma, but give support. Altogether, we are Team Nagaland, and as we are successful today because of our unity and joint efforts. So I appeal to the citizens for their continued support, cooperation and participation to protect our people and continue to be green zone free of positive COVID-19.
Minister for Health and Family Welfare S. Pangupom said the desire of the people of the state to have its own lab to combat the pandemic is fulfilled. He termed this as a red letter day for the Nagas and dedicated the lab to the people of the state.
Kohima Naga Hospital. I am glad to announce the construction of the laboratory has been successfully completed. 4 dedicated research scientists volunteered to render their work for the cause.
Padma Shri Nidono Angami mentioned that BSL-3 lab is applicable to clinical, diagnostic, research or production facilities where work is performed with agents that may cause potentially lethal diseases through inhalation to the person working within it and may contaminate the surrounding without proper measures. She also said that the basic essential features of BSL-3 laboratory include the biosafety cabinet, unidirectional airflow using room pressure gradients of negative pressure, exhaust air being highly efficiency particulate air filtered and produces for proper disposal of lab waste. Sensing the urgency to have a COVID 19 testing facility in the state government had approved to set up biosafety laboratories BSL 3 level 3 in Kohima and BSL level 2 in Dimapur. She also added that while this facility has been set up immediately for the purpose of COVID 19 testing only, this specialized biosafety lab has huge prospects in future.
This is our sterilization room where we have autoclave machine. And this is the BSL 2 corridor here. Yeah, so these are more or less the main rooms for our.
The death toll due to COVID 19 rose to 3,435 and the number of cases to 1,12,359 in the country today, registering an increase of 132 deaths and 5,609 cases in the last 24 hours, according to the Union Health Ministry. The number of active COVID 19 cases stood at 63,624, while 45,299 people have recovered and one patient has migrated, it said. A senior health ministry official said around 40.32% patients have recovered so far. According to the health ministry data updated in the morning, the highest number of confirmed cases in the country are from Maharashtra at 39,297, followed by Tamil Nadu at 13,191 and Gujarat at 12,537. In the northeast, Tripura has reported 173 cases, Assam at 170, Manipur has 25 cases and Meghalaya 14. Mizoram and Arunachal Pradesh have reported a case till now. The severe cyclonic storm Amphan has caused extensive damage to the four coastal districts of Odisha, Bhadrak, Balasore, Kendrapada and Jagatsinghpur. The state government has asked the collectors of the four districts to submit a report within 48 hours regarding the damages caused by Amphan. The super cyclonic storm has caused havoc in north and south 24 Parganas, Howrah, Hooghly, Nadia, East and West Midnapur districts including Kolkata. The devastation caused by the super cyclonic storm is unprecedented in the history of the state. Most of the river embankments in different districts, including vast areas of Sundarbans, have been breached. Huge number of houses, standing crops were damaged. Innumerable trees were uprooted. Telephone, internet and electricity connections have also been snapped in vast areas as trees, electrical pillars were uprooted on the roads. Vehicular traffic movements were also disrupted in Kolkata. Water supply has also been affected in different areas. Different agencies including NDRF, SDRF, civic bodies, fire brigade have started relief and restoration work on a war footing. A day after announcing resumption of domestic commercial passenger flights from May 25, the Civil Aviation Ministry today issued detailed guidelines for airlines, airports, passengers and other stakeholders. The ministry said it will prescribe lower and upper limit of airfares and airlines will have to adhere to it during the period of COVID-19 pandemic. On the day of commencement, that is on May 25, limited operations about one-third would be permitted, it said. It said passengers will have to report at airport 2 hours prior to the flight's scheduled departure time and only those who have done web check-in will be allowed to enter the terminal building. Only one check-in bag would be allowed and airlines will not provide any meal services in flights, the ministry said. Boarding for a flight will commence 60 minutes before departure and boarding gate will be closed 20 minutes before departure, it said. All scheduled commercial passenger flight operations have been suspended since March 25, when the Modi government announced the nationwide lockdown to combat the coronavirus pandemic. Civil Aviation Minister Hardeep Singh Puri had announced on Wednesday that domestic flights will resume from May 25 in a calibrated manner. The online booking of tickets for 200 trains which will run from June 1 commenced from 10 a.m. today. These trains will be fully reserved trains having both AC and non-AC classes. General coaches will also have reserved seat for sitting. there will be no unreserved coach in the train. Only 4 categories of Divyanjan concession and 11 categories of patients concessions are permitted in these special trains. The fare in these trains will be normal, and for general coaches, second sitting fare shall be charged and seat will be provided to all the passengers. No catering charges will be included in the fare. For these trains, only online e-ticketing can be done through IRCTC website or through mobile app. No tickets will be booked across the reservation counter or any railway station. All passengers must wear face covers or masks upon entry and during travel. The passengers will have to reach the station at least 90 minutes in advance to facilitate thermal screening at the station. Only passengers who are found asymptomatic will be permitted to travel. Global coronavirus cases surpassed 50 lakhs yesterday, with Latin America overtaking the United States and Europe in the past week to report the largest portion of new daily cases globally. It represents a new phase in the virus spread, which initially peaked in China in February, before large-scale outbreaks followed in Europe and the United States. Latin America accounted for around a third of the 91,000 cases reported earlier this week. Europe and the United States each accounted for just over 20%. A large number of those new cases came from Brazil, which recently surpassed Germany, France, and the United Kingdom to become the third largest outbreak in the world behind the United States and Russia. Cases in Brazil are now rising at a daily pace, second only to the United States. The pandemic has claimed over 326,000 lives, though the true number is thought to be higher as testing is still limited and many countries do not include fatalities outside the hospitals. Over half of the total fatalities have been recorded in Europe. In the United States, 92,387 people have died, the highest figures for fatalities. The United Kingdom has the second worst death toll at an official 35,704, ahead of Italy 32,330, France 28,132 and Spain 27,888. Despite the continued increase in cases, many countries are opening schools and workplaces following weeks of lockdown that have stemmed the spread. According to the Health and Family Welfare Department, a total of 1,001 samples have been sent for testing from the state. The results of 978 samples have been received and all are negative. The results for 23 samples are awaited. In addition, through the TrueNat testing machine, so far a total of 27 samples have been tested and all are negative. Altogether, a total of 1,214 persons are presently at facility quarantine and 6,967 persons are out of home quarantine. The Home Department Relief and Rehabilitation Branch has informed that the provision of payment of ex gratia amount of Rs 10 lakhs by the state government to any employee of the Nagaland state government suffering fatality due to COVID-19 while performing frontline duties is extended to cover drivers, cleaners, sanitary workers, caterers and all such personnel or workers involved in the management of the quarantine centers in the state, as well as to any other non-government functionary involved in any other activities for combating COVID-19 under the District Task Force. The state government has decided to set up an institutional quarantine center for the stranded persons returning to Nagaland at the Special Economic Zone Ganesh Nagar, Dimapur district. Further, it has been decided that Autemse DIG Training Chamugitima shall be overall in charge of the quarantine center and he shall put in place for all arrangements including fooding, basic amenities and logistics in the quarantine center. And with that, we come to the end of this bulletin. Stay home, stay safe and take good care of yourself. Bye for now and thanks for watching.